This video touches on a difficult subject. There are a lot of factors to take into account, and some factors may matter more than others based on what you feel. I may not cover all of them in this video, but you will get to know those things in my future videos. Here I will talk about the basic factors that I feel. What I feel comes into play when you decide whether you want to become a doctor. We'll talk about some common reasons for which people join medicine. First, parents. The number one factor that I've seen happen is parents forcing you to become a doctor because it is a matter of pride and they kind of emotionally blackmail you. Look at Mishra's son, he's so smart, he studies so well, he's gotten into government medical college. You should also get into medical college and become doctor and make me proud, no? No! There are so many things wrong with these lines. First of all, never compare yourself or your children to other people or their children. Becoming a doctor isn't the best thing in the world, and people who are doctors aren't people who have the highest IQ. One thing that you should do is work hard. Take it down, guys. Hard work. But you yourself should try to figure out what you're good at and what interests you. You like robotics, but your dad wants you to become a doctor? No! You'll do better doing something that you love. Personally, I am not capable of working in a field that doesn't interest me. The only reason I survived medicine is because I loved the field and I loved working, even if there are long hours. I've seen people join MBBS with various reasons and they just fail or they don't feel content after finishing their course. Trust me, when you work days in a row and stay in the hospital and only work, you need to like your job or you'll go insane. Okay, next. MBBS is the only course if you like biology. We've all been there. Some uncle or auntie will come up to you and say, "What do you want to become, doctor or engineer?" No, that's the stupidest question to ask. There are so many jobs out there. It's hard to imagine that so many people don't do the research about the different courses you can go for. If you don't want to go through the long path of MBBS, PG degree, super specialization, and maybe even a fellowship, you can opt for other courses. Some of the other courses are dentistry, veterinary science, PharmD. Some people do a BSc and then MSc and sometimes even a PhD, and they become very successful. Bottom line is that you should do your research on the different courses and then make an educated decision, rather than blindly following something that someone else says. I also understand that this is a young age to make a life-changing decision, so you should always take the guidance of an adult who themselves are not biased. 3. I want to earn a lot of money. Well, I wish this kind of was true. Well, you could say that you would get decent money in medicine. Not all doctors are rich, but you can earn enough to have a comfortable lifestyle. Most doctors are probably in the upper middle class. But there are also a lot of factors that play into this. First of all, your specialty after your MBBS and whether you actually just work with only an MBBS degree, and then whether you're working in a government setup or you're working in a private setup, and then how many patients you get in a private setup. All of this matters. But on average, most of the doctors will only start earning the real bucks probably in their 40s or maybe a little later than that. 4. I want respect. What respect? Have you guys seen the headlines? The way patients treat you mostly depend on their character. And in the hospital, mostly since you're treating them, they will respect you. I'm not saying that doctors aren't respected outside at all, but maybe not to the extent of 20 years ago. I'll make more videos about my experiences and my patient stories, and you guys yourself could determine with that. 5. I'm super intelligent, so I want to become a doctor. So this is a good reason, but you should also remember that more than intelligence, it's hard work that comes into play. And if you are great at memorizing and gaining knowledge, that's great, you can reach great heights. But also talking to patients and taking care of people is a bigger skill in becoming a doctor. You may be intelligent, but you also have to be smart, as problem solving is a very important thing. Reasons to become a doctor. These are some of the reasons that I think that you should have to become a doctor. If you're dedicated and you know that this is what you want to do and you're very interested, then you'll do very well. Before joining, I recommend asking a doctor whether you can go and observe them and see how the work is, how the patient care is, and etc. Medicine isn't just a job, it's a lifestyle, and you need to know what to expect. Wherever the art of medicine is loved, there is also a love of humanity. You want to help people? That's great. Medicine is one of those jobs where you will be taking care of so many patients. It's likely that you'll actually make relationships with them for life. And you'll have such an influence in their life, and it's a huge responsibility, but also it's an honor. Some of the things that you should be ready for when you're joining medicine: hard work, long hours, sleep deprivation are some of the things that you'll face, but at the end, it's all worth it. Critical thinking and problem solving. You'll be faced with many challenges in patient care, and you may not have the answer from a textbook or research guidelines to help. This is where skill comes into play, and this is one of the biggest reasons I love the field. Failure. I'm not just talking about exams, but you lose patients, you may not treat them in the right way. There are so many ways you can fail, and you will. But that's how you learn, and that's the path of the shinobi. I mean doctor. Reading for the rest of your life. Medicine is an evolving field and we don't know everything. So the so-called facts will change, treatments will change, new techniques will be invented, and there is always something new to learn in this field. So be ready for that. Family time. There will be significant reduction in your family time, and this may play a big role for you. So you have to think about that before joining MBBS. So in conclusion, I'd say that if you love medicine and you've had a first-hand look in hospitals and patient care, and you're ready for all the hard work and sacrifices, then you're a perfect candidate to become a doctor. Okay guys, I'll also be posting more videos about medical college, life, work, and people I dealt with. I always love to listen to all these stories by other medicos. If you're looking to see whether you want to become a doctor or you just love listening to all these interesting patient stories and about doctors in real life, subscribe and watch more of my upcoming videos. If you have any questions or any specific videos you want, you can just comment below and give this video a thumbs up. Till next time.